Okay, we're right at 4. We'll get started. Good afternoon. This weekend brought news of Madison County's second confirmed case of COVID-19 and its first case of what is deemed to be community spread transmission of coronavirus. This development underscores the importance of stringent adherence to social distancing guidelines. And as in other communities that have instances of community spread, it triggers orders from the state government that place new restrictions on some business operations and healthcare services. These new restrictions, ordered by the Nebraska Department of Health and Human Services, come to us in the form of what are called directed health measures. News of the confirmed case of community spread was released Saturday night by our area public health department. The directed health measure that followed took effect as of 9 a.m. yesterday. The directed health measure primarily deals with key new regulations, including mandated limitations on social gatherings to 10 people or fewer, limiting restaurant services to takeout, curbside, and delivery options only, discontinuing on-site consumption at bars while allowing for curbside and takeout options, and prohibition of elective surgeries at our healthcare centers. Gina Ewing, who is director of the Elkhorn-Logan Valley Health Department, will speak in more detail about this particular confirmed case and the related directed health measures. So what does this all mean for Norfolk and the surrounding area? It means that, like other communities around our state and nation, we are entering into a new chapter of efforts to slow the spread of coronavirus. As inevitable as it was, the virus is here, and we are likely to see more instances of positive test results. It means that each of us, following recommendations of social distancing and aggressive cleanliness, is now as important as ever. In the last week, the city of Norfolk took steps to mitigate the spread and impact of coronavirus. We restricted public access to city buildings, while our staff continues to work diligently to provide public services. We issued a formal emergency declaration allowing for the city and Madison County to access all available state and federal assistance in preparing for and addressing COVID-19. We also worked with the Norfolk Chamber of Commerce to organize a virtual small business roundtable connecting nearly 150 of area small businesses with various resource organizations like the Small Business Administration and local banks to help them utilize available assistance during this extremely challenging time. This is an unnerving time for all of us. It's painful, it's uncharted territory, and it's frustrating. But think how much harder it might be lying in a hospital bed or with a loved one hospitalized. That's what we're working here to do, to prevent that scenario for you or a family member, by staying apart to protect the most vulnerable to this virus, the elderly and the sick. Staying apart now, as best we can, will help us more quickly come back together. And while we hunker down and show resolve to beat this virus, we have time to reflect on some potential silver linings. Families are spending more time together, more of us are getting outdoors and into nature, and neighbors are helping neighbors in creative and ingenious ways. This weekend, my children and I spent time doing things we might not otherwise take enough time to do. On a rainy Saturday, we played board games, we made a makeshift indoor bowling alley, and we made dinner together. We cleaned out our pantry on a sunny Sunday, rode bikes to deliver food to the rescue mission in our neighborhood food pantry. I'm seeing Norfolkans and Northeast Nebraskans doing incredibly creative things to pitch in and help. Area schools, in partnership with the Nucor Detailing Center, using 3D printers to make masks. Local businesses rallying around each other to utilize each other's services. Our relief organizations going out of their way in new ways to serve neighbors in need of help. And our faith community utilizing technology to come into our homes, offering words of healing and hope. As in all things, this too shall pass. It may take a bit longer than we'd all hoped, but we'll get there, working together by following proven practices of staying apart to break the chain reaction of virus spread, while supporting each other and our small businesses in the process. I firmly believe we can come out of this even stronger, more resilient, and better friends and neighbors in the end. Now I'd like to ask Gina Ewing, Director of Elkhorn-Logan Valley Public Health, to come forward.
Good afternoon, media partners, community partners, and audience watching online today. I'm the Director of Elkhorn-Logan Valley Public Health Department, and it is an honor to serve the constituents of Burt, Cumming, Stanton, and Madison counties. Ever since the 9/11 event in 2001, our department staff has been preparing and planning for response to disasters, emergencies, and outbreaks, such as the COVID-19 virus that we're experiencing today. In early 2020, when the coronavirus appeared to be an imminent threat to the United States, to Nebraska, and to our communities locally, our staff shifted gears to focus on the looming coronavirus. Then March hit. The U.S. saw its first case of coronavirus, and on March 6th, the first case was confirmed in Nebraska. Since then, several other cases have been confirmed. The count, as of this time today, in Nebraska is 145 confirmed cases, 2 of them being from Madison County, and 2 deaths in Nebraska from outside of our health district. To date, 115 COVID-19 tests have been conducted in our 4-county health district, including 96 negative tests, 2 positive tests, and 17 tests pending. The first positive test in the district was 1 week ago today. After a thorough investigation and an attempt to pursue further laboratory testing to determine the origin of the virus in the first confirmed case, we learned Saturday that the results of those further tests were non-conclusive. This means that whether the virus was travel-related or community spread will not be known. However, Saturday's appearance of the virus in a local long-term care facility underscored that the virus is indeed present in our health district. Due to us not being able to determine any logical explanation as to where or how the second individual may have become exposed and later contracted the virus, the case was characterized as community spread. This designation sparked the Nebraska Department of Health and Human Services Chief Medical Officer Dr. Gary Antone and Governor Ricketts to initiate directed health measures in the counties of Burt, Cumming, Stanton, and Madison. The measures were signed on Sunday, March 29th, and went into effect at 9 a.m. yesterday morning and will remain in effect until May 6th unless otherwise extended by the governor or the chief medical officer. Burt, Cumming, Stanton, and Madison counties joined 14 other counties in Nebraska in having these directed health measures enacted. The measures take the previous recommendations and suggestions that we had put forth and now make them required in the 4-county area. The penalty associated with noncompliance is a Class 5 misdemeanor. Our department has worked with local law enforcement officers to ensure their awareness of the measures, as well as their willingness and ability to enforce these measures in the communities in which they serve. These measures include 4 main topics. First, quarantine of individuals that have tested positive, as well as for anyone in the 4-county area with symptoms consistent with COVID-19, including fever of 100.4 degrees or above, cough, or shortness of breath. This quarantine is for 14 days from the onset of symptoms for the person that is sick and for all of their household members. In addition, the household members must quarantine for an additional 7 days after the original person has been released from home quarantine. Those under quarantine may leave home to access necessary medical care, but should do so in a way that does not unnecessarily expose other patients and healthcare workers. Calling ahead and following the directions of the respective healthcare facility is very important. For symptomatic individuals with an alternative recent diagnosis, such as influenza, a bacterial infection, or a different viral infection, or even seasonal allergies, a diagnosis from a qualified medical provider are not subject to this quarantine order. Individuals with symptoms from these types of diagnosed conditions or illnesses should remain at home and be 72 hours symptom-free before going back into the community or to work. Second, the gatherings are prohibited that bring together 10 or more people, customers, or invitees in a single room or space. For business places, this excludes staff. These provisions do apply to schools, daycare facilities, including in-home facilities, gyms, salons, fitness centers, and others. This also includes weddings and funerals, as well as other indoor and outdoor events. These provisions do not include office environments, retail or grocery stores, nor does it include public utilities or city and county operations. It is our desire to keep essential businesses and community functions in operation so that we may continue to enjoy the comforts and protections in our homes and in the communities, as well as continue to have access to groceries and household items needed for basic survival. These provisions do not include large household residences where 10 or more people live. However, they do include home-based parties and gatherings that would invite or generate more than 10 guests from outside of the household. Third, liquor, beer, and wine sales are restricted to carry-out sales and delivery only to the extent that's permitted under the law. No on-site consumption is permitted. This includes food and drinks served in bars, taverns, private clubs, and food or beverage sales at restaurants or other dine-in establishments. And last, the fourth provision in the directed health measures includes the prohibition of elective procedures and surgeries in the healthcare sector. This is included because of the severe and anticipated continued shortage of personal protective supplies for our healthcare workers, such as masks, gloves, goggles, hoods, and other essential supplies. Momentarily, you will hear directly from Faith Regional Health Services regarding their specific internal compliance with this measure. However, I would like to take the opportunity to personally thank all the healthcare sector partners in our four-county area for their diligence and proactive initiation of protocols to preserve our supply of these personal protective supplies to the greatest extent possible. Likewise, they have done an excellent job of enacting policies and procedures, to prevent the exposure and spread of COVID-19 to their staff and patients. We really do have excellent healthcare resources in our district, and I am proud to call them my partners. Finally, I would like to end with an expression of gratitude to the wonderful staff and board of our department. You truly have dedicated and talented group of public health workers that have been called to serve you. These staff have given relentlessly of themselves and have put many, many long-hour days in over the past month in order to fulfill our public health obligations in our service area. Our board has been incredibly supportive of all that has been done, and they wish to extend their appreciation to the staff and the community partners for all that they have done to flatten the curve in our district and beyond. Thank you for entrusting me to serve you during these unprecedented times. It truly is an honor and a responsibility that I do not take lightly. I deeply appreciate your continued support of our department, our staff, and our work. It was a little over a year ago when we stood and talked about Nebraska Strong following the floods, and I believe that that still holds true for us today as we overcome this coronavirus that's coming into our communities, our counties, and our state. Thank you.
Thank you, Gina. I want to say thank you to Gina and her colleagues at Elkhorn Logan Valley Public Health. I know this has been a very challenging time for them. They are on the front lines of this, and they're working very hard to be open and transparent with us as information regarding coronavirus changes by the hour. So thank you, Gina. Next, I'd like to bring up Kelly Driscoll, who is CEO of Faith Regional Health Services, while I try to fix this mic. Bear with me. There we go. Thanks, Kelly.
Good afternoon. It's ironic that we stand here today with this healthcare crisis pandemic because today is Doctor's Day. And so I thought it was important that we acknowledge that and respect the mission that our physicians in our communities do, in our communities to keep us healthy and safe. And so on behalf of Faith Regional Health Services, I wanted to say thank you to all physicians and thank you for what you do for our communities. At Faith Regional Health Services, we've been preparing for this since the middle of February as the cases increased and started coming towards the United States. With the directed health measures implemented by the governor yesterday, we have changed some of our processes at Faith Regional as well as we've been evolving over this time. One of the areas was the elective procedures that are prohibited in all of the Elkhorn-Logan Valley Public Health District. We started removing elective procedures already by the advice of the governor as of over 2 weeks ago and have been going to more of an urgent need. But now, as we know with the directed health measure, it is prohibited district-wide. And that is to prevent the transmission of COVID-19 and to help conserve medical supplies. All elective procedures and surgeries in the entire public district will be prohibited through May 6th. Elective is defined as a surgery or procedure that is scheduled in advance, but it does not involve a medical emergency. Having said that, some procedures will still be allowed on a case-by-case determination by the medical provider and the patient on an urgent need. At Faith Regional, our supplies, we are on a strict allotment as every other healthcare hospital in the nation is on. And the allotments that we are in need of, just as every other healthcare facility is procedure mask, ear loop masks in particular, N95 masks, isolation gowns that are large, XL and XXL. So I guess this would be, we would welcome donations, and thank you to those that have donated, including Nucor with their ingenious idea of the 3D printing. Our nursing staff have just loved that concept completely. But if you are a health sector, we would welcome those donations of those particular PPE items in particular, because we are on a strict allotment for that. Another area that we are updating is we are going to a no visitors policy. We had it down to where one visitor was allowed to be with the patient as long as they were symptom-free and did not screen out positive for COVID-19. Starting tomorrow, that will be no visitors allowed, except for in the case of labor and delivery, one symptom-free significant other can be with that labor patient, or under any extenuating circumstances such as end of life, we will allow a symptom-free visitor to be with that person. That will impact the entrances that will be open to Faith Regional Health Services as well. So currently, starting tomorrow then, our West Medical Office building, our South Medical Office building, and our ER entrances will have access points for patients and the visitor under an extenuating circumstance. That is also assuming they do not display symptoms, again, of COVID-19, and they'll be screened at that door on a limited basis. Several questions that we've been getting, and I know this is on many people's mind, is on the testing procedures, and I know people have heard about either the lack of testing or the increase in testing, so I wanted to address that today as well. We did, as we talked about the last time, we do have an off-site testing clinic, and that again is not open to the public. That is by order of the provider only, and we still have that up and functioning and doing tests daily. Yesterday's guidelines state that, and one of the common questions, and with this guidelines I wanted to underscore this, was, well, why can't we just test everybody? You know, why can't we test everybody? I think they've been exposed, let's test them. And the testing guidelines are very, very clear right now, and while we'd love to be able to test everybody, the state of Nebraska just does not have the capabilities yet to do that. It's improving every day, but right now that capability is not available. Patients with a clear source of an exposure, so a household member with a known lab confirmed test and clinically presents with symptoms of COVID-19 can be clinically diagnosed and do self-isolation without a confirmation test. And that is the recommendation on a normal, healthy adult that is just displaying some symptoms and does not need hospitalization. One of the new pieces to this is that the influenza test is not necessarily required now, versus in the past it had been required before a COVID-19 test could be ordered. That can be on the best clinical judgment of the provider that you're seeing. So the patients that will get the actual COVID test or that qualify for the COVID test are anybody that would be admitted to the hospital, so hospitalized patients that would be showing symptoms consistent with COVID-19, all healthcare workers that are ill, outpatients who are at high risk or vulnerable populations, such as individuals greater than 65 years old, and anyone with an underlying condition where a COVID-19 infection could result in a possible mortality. Anybody, residents and staff at nursing homes, group homes, residential facilities, areas where there would be a large number of people that live, and then our first responders and public health services. Those tests then are prioritized on that basis due to the not quite having the capacity to do further testing. And as soon as Nebraska, they're working on it every day, there's improvements every day, and as soon as more tests become available, those policies will change as well. Last, I'd like to talk about some of the things St. Joe's rehab did with the patient that was positive. And on March 10th, they did enact a no visitors policy, and that was strictly enforced, except under extenuating circumstances. And there were 2 family members that were allowed to visit under extenuating circumstances for that patient. The patient is in isolation and has been since March 24th. The facility is following all active state, federal guidelines and will continue to do so. So we will continue to be in contact and following the guidelines as prescribed and changing and updating those if they get changed as well. Thank you.
Thank you, Kelly. Appreciate that update. Faith Regional is not only Norfolk's hospital, it's Northeast Nebraska's hospital, and it covers a lot of ground and a lot of territory, and Kelly has assembled one of the best and most capable teams to address a crisis like this, and our thoughts and prayers should be with them as they will continue to see more and more demand before we're out of the woods on this. Next, I'd like to bring up Troy Euler, who is chairman of the Madison County Board of Commissioners, for an update from Madison County. Troy.
Thank you, Mayor Morning. We at the county want everyone to know we are currently trying to function as best possible under the guidelines we have been given under the directed health measure. Safety for our citizens and county employees is very important to us. With that, we enacted 2 weeks ago that we would be by appointment only for business conducted at the courthouse. We ask that you call ahead or call when arriving to the courthouse that you will be let in. We are asking those coming for the treasurer's office, county assessor, county clerk, register of deeds, that you would come to the south doors. County court and district court are doing their best to conduct business as usual. They are asking for only those that need to appear come to court. Please use the north doors when entering for your court hearings. All off-site offices are also following the appointment-only restrictions. This includes public defender, planning and zoning, veteran services, and the UNL Extension Office. The Commissioners' meeting for tomorrow, March 31st, will be conducted through Zoom conferencing. We have information on the county website as to how to log on to this meeting. The Sheriff's Office has set some guidelines for how they are functioning under this measure, which can be found on their Facebook page or the county website under the Sheriff's Office. We are asking all the communities in Madison County to look at the directed health measure being handed down by the governor so you see how this affects you and the businesses in our county. This can also be found on the Sheriff's link on the county website. Please follow these guidelines so we are all doing our part in keeping Madison County as safe as possible.
Thank you, Troy, for that update. As you see across the state, cities and counties are having to work hand in hand to address this challenge. We have a very strong partnership between the city of Norfolk and Madison County, and we're grateful for that. One of the things the county did a couple weeks ago was formally declare emergency, which allows for access for local governments to state and federal government resources. The city followed suit last week, so we're working in partnership on that. Another area in which we work together is emergency services. Next, we're going to hear from Shane Widener, who is the Director of Public Safety for the City of Norfolk.
Thank you, Mayor. We're in a bit of a fight, unconventional fight, an unconventional health and safety emergency, but a true health and safety emergency. It's no news to Nebraska that the whole world's dealing with this, and we're not immune. So as we deal with this, I'm going to ask directly to the community and to, well, everyone that can hear to help us in this fight. This isn't something that we can conquer in a vacuum, but it is something that we will conquer. If we follow the directed health measures, we follow the advice of our experts that you've just heard from, and all the ones out there that you hear from daily from our state, from our governor, from all the way up to the President of the United States, we're going to be successful. But this is a true health and safety emergency. So in light of that, I, again, will ask you directly to respond accordingly and to follow those directions. The public safety providers in the region are ready. As I said last time, they're prepared, as they always are. We got a pretty significant cachet of personal protective equipment. We're not perfect in that, but we have enough that we can respond for a while now, and that's not a small thing. When you look at personal protective equipment, you're apt to see the firefighters and police officers and sheriff's deputies, even the sheriff himself once in a while perhaps, out there with personal protective equipment on. As they respond to emergencies and do their business, you'll see that from time to time, especially in the ambulance world. I tell you from personal experience that this is happening across the region. It's not just a Norfolk thing or a Madison County thing. Our EMTs and paramedics and fire chiefs and police chiefs and sheriffs across the region have been preparing themselves and the staff here. When it comes to the directed health measures and the enforcement of that, I spoke, as I often do, with Sheriff Volk and Chief Miller this morning and asked them for some guidance on how their approach would be to the directed health measures. And they informed me they've been getting questions as of yesterday morning about enforcement and how that works. And, you know, it's in their charge to enforce the directed health measures when it comes to certain aspects of them. In particular, the social gatherings, bars and restaurants, and reduction of services available at those establishments. And they're prepared to do that and will do that. They're going to use it as an opportunity to educate, but they still have a duty to enforce, and they will enforce. So again, I'll ask you for the third time, please follow the directed health measures that are out there in front of us. Do them wisely, protect each other, social distance, and we'll get through this thing. It's really a matter of doing that. There's been a lot of circumstances in the build-up to the response to coronavirus that you could see transmit to some lackadaisical, to some extreme measures. But the time is here. It's in front of us, and we have to perform as a community, and we have to take care of each other. So I'm asking you as a public safety director to do that. That's going to be important for our success. That's really where we're at from the public safety world. I'm proud of each and every one of them. The men and women that are on the front lines and in those squad cars and in those ambulances and fire trucks and at the ER, I can tell you that they are exceptional professionals. So they're out there in harm's way and doing the job. So I couldn't be prouder of them, but they need your help and assistance. So be wise and be supportive of each and every one of them. Thank you.
Thank you, Shane. Norfolk Fire and Police Emergency Services have spent years and years building a culture of excellence and professionalism and that's on display daily here. It's especially in these times that these folks shine and rise to the occasion. So thank you, Shane, for your leadership, Sheriff Folk for your leadership at the county level. With that, we'd take any questions from the media.
With regards to St. Joe's, are there plans in place to test all the residents at this time there, or is it just going to be a matter of testing residents who may have had contact with the patient at this time?
Okay, good question. I'll let Gina address.
At this time, due to the limited number of tests, there is not a plan to do mass testing in that facility. It's not recommended that they do so. However, anybody that should become symptomatic, that we have a reasonable suspicion of infection, those folks will be tested. But there's too big of a shortage of supplies right now to do a mass testing event.
Just a question on clarity. So does Faith Regional then do independent tests? And if they do they count toward the Elkhorn-Logan Valley Public Health Department's numbers?
So the question was about, does Faith Regional do independent tests and does it count towards the Elkhorn-Logan Valley Public Health numbers? And the way the testing process has evolved is it started with just state through the Department of Health and Human Services doing the testing, and then it started including Nebraska Medicine, and they have up to, I believe, 400 tests a day, and some commercial labs as more testing has become available. So while we get the tests and send the tests, we don't independently do the results and do the testing. That still has to go through a approved lab, either through the state or a state, federal, commercial lab that was given approval for that, which has been part of the limitations.
I see. So like the numbers Gina gave earlier would be comprehensive, right?
Yes, that is correct. We get reports from all of our healthcare facilities every day. We ask them to send their tests at the end of the day. So if they're sending them to commercial labs independently, those are numbers that are included in our comprehensive count.
And then earlier, a week ago or so, there was a lot of emphasis on flattening the curve, trying to delay this. Do you think the community has so far? I mean, even though there's been 2 positive tests, is that to be expected? Or overall, do you think people have been careful and trying not to gather in large groups?
Yes, I do think that the community, all 4 counties, have done a great job of, to the best of their abilities, adhering to the social distancing recommendations. In response to the question about flattening the curve, Nebraska is number 45 in the nation and state, so we are definitely on the bottom end of the confirmed cases, and that might be due to testing availability, but there's other states that are also having testing shortages. So I do believe that the flattening the curve concept of not having large-scale exposures, which would result in a potential overcrowding of our healthcare system, so far I do believe that that's been effective because we haven't seen any admissions or any access to the healthcare facilities that I would call overcrowding at this time.
As far as Faith Regional is concerned, at the hospital, are there an adequate amount of ventilators on hand at this time that you guys have, or are those among one of those items that you may be willing to receive donations from other healthcare providers for?
At this time, you know, with the elective surgeries and procedures being canceled, we do have the ability for 32 ventilated patients. Keep in mind that would not be all COVID-19 because we use ventilators for all sorts of emergent conditions as well. And that would also be utilizing our anesthesia machines and doing a similar process you may have heard that Omaha and Lincoln is doing and converting those to a ventilator at this time. So at this time, we feel like that would, you know, double our capacity, which has been the goal that each hospital needed to do.
Sorry, I have one more quick one. And then as far as St. Joe's is actually concerned again, the staff on hand at St. Joe's, are they being monitored at this time, or how is that working as far as the staff there who are caring for the patient or just caring for the facility in general?
Yeah, the St. Joe's staff have actually been doing active, what we call active monitoring. So they've been doing active monitoring since the middle of March, actually, and checking temperatures twice a day and other symptoms before and after each shift. And that will continue as well, and the state and federal guidelines will be followed if there happened to be a symptom that would be shown from staff. And we also have a self-monitoring of all our employees at Faith Regional Health Services as well, where we're doing a self-monitoring of temperatures twice a day, at least 8 hours apart, and monitoring for symptoms as well.
Is there anything set in place, let's say a resident were to leave Norfolk or leave Madison County, is there anything set in place for them leaving and then coming back? Any requirements that they need to do?
Not at this time. Gina, I don't know if you want to address that as it applies to the quarantine issue as it's addressed in the directed health measure.
Right now, there are no expectations that people don't go in and out of counties. We need people to go in and out of counties, and in some cases in and out of states for essential business travel, especially for those counties that are near state borders. It's very common for them to have healthcare employees that might live out of state and cross the state line to come to work. As long as the people are not ill, and if they are ill, they should be abiding by the quarantine under the directed health measure. So healthy people should be able to go about their business and go to work or go to medical appointments in other counties. We are highly discouraging non-essential travel, whether it be work-related or just for domestic purposes. We want to prevent exposures from other places in Nebraska and other states, and then have those exposed people come back here to us and our communities and potentially expose more people here. So there's not any requirement other than the quarantine, but we are strongly discouraging any pleasure travel or any domestic travel that's not essential.
And before that, I'd want to reemphasize that point. I think it's very important that unless it's absolutely necessary, travel is discouraged. And that's all in an effort to limit exposure to this virus.
And then looking back on that first positive COVID-19 case we had in Madison County, I know there's some question about whether that was community spread or if that was travel related. Do we know at this time if that was also community spread or travel related, because it was still kind of up in the air last time that we heard about it?
Right. On Saturday, we learned that the additional laboratory testing results were non-conclusive. So what that means is that we're not going to know. The individual did recently have international travel, but the incubation period had already lapsed. We were going to come out in the media today with a release about that case until Saturday when our other case came, and then it basically underscored the fact that we have community spread. So it's no longer as big of a question or issue where the first person may have contracted the virus, because we know now for sure that it's in this community.
I don't see any other questions from the media, but I do have one. I'm getting this question in the community. Daycare centers and how they may be affected with this new directed health measure. Gina, can you address that?
Daycare centers is a common question that we're getting to at the Public Health Department. And as of this point in time, recommendations are always changing, but as of right now, daycare centers are still able to keep open as long as they abide by the 10-person limit, excluding staff. That also includes in-home childcare centers or providers. The exception to the 10-person rule is large centers that have multiple childcare rooms that are divided by closed doors. So in those centers, as long as they're abiding by the state licensure requirements as far as numbers, they can still continue their services. They cannot mingle in any eating areas. They can't mingle in any play areas. They have to be separate at all times. So it's requiring some of these larger facilities, these childcare facilities, to amend their normal operations and perhaps cook the meals in the kitchen and then deliver them to the respective childcare rooms to keep the children separate. Bathroom facilities, those are still okay, but we're trying to encourage the providers to limit mingling of children from different rooms in the bathroom facilities at the same time. And last, we don't like mingling of staff from room to room. We would like the same staff members to be assigned to a particular child care room and stay there. Then that way, if there were to be an exposure in a child care facility, the list of names and contacts is so much smaller than if it was 60 kids, multiple providers. So we're trying to just keep that net pretty narrow so that we can have a limited number of exposures should an exposure happen in a child care facility.
It seems like there's always a lot of questions about who can get tested and how that works. Ultimately, and I appreciate everything you said, Gina, about the order and kind of going through before determining if you get tested, but who ultimately decides then if somebody gets tested? Is it like the patient's doctor, or is it a combination of several people?
Earlier on, it was, because of the extreme limited capability of doing testing, it was directly approved through the public health department and the state. As more commercial labs have come on board and have had some more testing availabilities, there are more commercial labs that have been allowed to do that. So ultimately, the provider, based on their clinical judgment, can order a COVID-19 test through a commercial process. They could not go through the state process without a state approval or the public health's approval, but they can send a commercial lab approval and go through that process and swab. We're just encouraging that certain criteria be used because of the limited testing that we have available.
I don't see any other questions from the media. I do want to thank everyone for being here today. Thank you for tuning in. This is a fluid situation. It's difficult, it's challenging, it's changing at a rapid pace. We want to stay in front of you with new information as soon as it comes to us, so you may very well be seeing us again as developments happen in the community. I think it's important to emphasize as we draw to a close here that Nebraska is doing well, as we heard, comparatively well to other states. I think that's because we acted as a state early, and people have been doing a good job of adhering to the social distancing guidelines. But it's now as important as ever to do that now that we have a case of community spread. The more we follow these rules and abide by them, the quicker we can get through this and come out the other end. So again, thank you for staying tuned. Thank you for being vigilant about your health and the health of your neighbors. And thank you. Good evening.